Hello and welcome once again to our Doctors Roundtable, because as the COVID cases surge across the country, anxieties, fears and indeed viewer questions are only increasing. So as always, we are bringing to you top doctors to answer all your questions to COVID 2.0. Please welcome on the show Dr. Bela Sharma, Additional Director Internal Medicine at the Fortis Memorial Research Institute in Gurugram. Dr. Vinny Kantru, Senior Consultant, Pulmonology and Respiratory Medicine at the Apollo Hospital in Delhi. Dr. Hemant Thakkar, Consultant Physician and Cardiometabolic Specialist at Breach Candy, Jaslok Bhatia and Reliance Hospitals in Mumbai. And Dr. Samrat Shah, who's Honorary Internist to the Governor of Maharashtra and Internal Medicine Specialist at several Mumbai hospitals. Thank you all very much for joining me. Let's get cracking with our FAQs as always. Dr. Thakkar, you know the rules of the game. You've come before. Let's try and get a sense for our viewers with the first big question. Someone is asking, I have COVID symptoms, but my test is negative. Is RT-PCR not catching the new strain of the COVID virus? This is being asked by a number of people because fake negative tests are often being seen even though people have COVID symptoms. What should they do, doctor?
So let me tell you at the outset, we are not treating the report, we are treating the patient. If the patient has COVID symptoms, the patient needs to be treated. We also know that there is a big slip between the cup and the lip. The method of taking the test, probably an inadequate sample, maybe the burring of the swab into the mouth or in the nose was not adequate. The transport may have been an issue, or maybe you took it too early. You had symptoms and you took it too early. So you treat the patient and you repeat the test after 48 hours. Because what are you worried about, my friend? You're worried about the report or you're worried about the symptoms? I want to treat the symptoms and you worry about the report, but I'll treat the symptoms.
But why are the tests... No, but why, so doctor, are the tests sometimes not catching the... Is it possible that there is a virulent strain out there which the tests are not able to catch? Do you believe that?
No, you know, even if it's a virulent strain which has mutated, the RT-PCR would pick it up. But then if the viral load which has been swabbed is less, or the area of swabbing is inadequate, you might need to repeat it. But if you have a COVID virus, it will pick it up in the RT-PCR. If not one, you have to do a second one, because we are seeing these days that the amount of virus extruded in the nasal and secretory passages may not be more in the first 2 days. You have to do it on the third day or the fourth day. So don't think that one test, one swallow does not make a summer.
So just to conclude that, Dr. Thakkar, if the test is negative but my symptoms worsen, do you advise X-ray, CT scan, or do you advise another test after 3 days?
So that's a very good question. If the test is negative and the symptoms are the same, we start treating. But if the symptoms worsen, here is where we do a CT scan on the 4th or the 5th day. Routinely, I want to warn all my viewers, do a CT scan on 7th day. But otherwise, to pick up the diagnosis and give it a label, we do the CT scan on 4th or 5th day if the RT-PCR is negative. And we've had so many patients admitted with positive CT scans with symptoms, and then we do the RT-PCR after admission, and lo behold, it is positive. So don't think that we are dealing with a strain where the RT-PCR escapes the virus. Not at all. It comes positive sooner than later, but we utilize the radiology CT scan to give us the diagnosis and label it.
Interesting. CT scan therefore becomes critical in such cases. Dr. Bela Sharma, why don't you take the next question, because linked to that is being asked, what should I look out for in my CT scans? What are the spots on the lung? Should I worry if they put me on steroids for my lungs? Actually, Dr. Vinny, why don't you take this, because you're a pulmonologist. What should I look for in my CT scans? What are the spots on the lungs? Should I worry if they put me on steroids for my lungs? Dr. Vinny, do you want to take that?
Yeah, well, yes. So the CT scan has got a particular indication to be decided on case-to-case basis, especially if your fever is going beyond 7 days, it's going from lower to higher grade. And as Dr. Thakkar explained, the test might be negative initially, or the person might be tested too late when they have already become negative. So there comes the role of CT scan, which can be very important to decide your next line of action, which could be use of steroids, especially in the second week. So what we see in the CT scan is for the doctor to interpret and decide the next line of action or the treatment. So patients frantically call their doctors, my CT scoring is very high, what should I be doing, whether I should be taking steroids on my own. So I really discourage the use of especially steroids as self-medication and hoarding of these medications at your home. You should consult a doctor whether you need these medications or not. The CT scoring is divided into three based on the level of severity of the disease. Anything less than 7 without any symptoms doesn't need steroids all the time. It has to be decided whether the patient is still symptomatic, they have high fever, they might be having breathlessness, they might be having decreased oxygen levels, especially low oxygen levels less than 93, 92. Also, the scoring between 7 to 4, which comes in the moderate category, along with certain comorbidities and presence of certain features, does decide whether a patient would need any kind of steroids as an outpatient or not. So if the markers are really high, some of the markers which are important in these patients, which include the CRP and the D-dimer, yes, steroids are important there, and these have to be decided by your doctor. And now comes the severe category where the CT scoring, CT scoring would be something more than 14 with hypoxia. So there, especially the use of steroids is useful and is known to decrease mortality.
Can I speak to you in 35 minutes? I'm on an interview. Right. Thank you.
Yeah. Yes, I just want to also bring in at the moment Dr. Sharma, because the next question in a way perhaps ends this particular segment, because I want to look at hospitalization. If I have a false negative and RT-PCR has not caught it, but I have the symptoms, do I need hospitalization? What is that critical stage when I need hospitalization? Because a lot of people are panicking and are trying and occupying a bed, and many hospitals say they don't need the bed. What is that critical state at which I need hospitalization, Dr. Sharma?
Yeah, it is like Dr. Thakkar has already said, we are treating the person, we are not treating the reports. If a person, most of the patients can be managed very well as home isolation. Let's face it, the number of patients who actually become serious and need to be hospitalized or need ventilation is actually quite less. So RT-PCR may be negative, like Dr. Thakkar has explained it very nicely, but if the patient is symptomatic, if the fever is not coming down, if the oxygen saturation is dipping, and again it is not a single dip, it has to be consistent, like we do the 6-minute test. A person walks for 6 minutes and then we check the oxygen saturation before and after the walk. If there are changes in the CT scan, then elderly people, people who are diabetics, people who are on other drugs, if they have any of these complications, then in that case we need to consider hospitalization. Hospitalization basically is required if a person requires, oxygenation in, as an emergency, or requires some IV medications or management. Otherwise, most of the patients can be managed at home. I hope I answered
most of the patients can be managed at home, but the question, but the question is, at what is that stage? What is that critical stage when a patient needs a hospital? Dr. Shah, when do you tell your patient, Dr. Shah, it's time for you to move to the hospital? If I have severe symptoms at home, even though my RT-PCR may be negative, do I move to the hospital? Is there a moment that I look at? What is that red flag when I'm quarantining at home, at which time I need to start worrying? Is there a red flag when I'm quarantining
Yes,
at home that I need to start
yes,
worrying,
I got
Dr.
your
Shah?
question. Yeah, I got your question absolutely correct. Now, what two clinical parameters I follow is one, drop in your baseline oxygen saturation by 3%. So if your oxygen saturation drops by 3% from your baseline, which you started on the day one of your infectivity, whether it could be at rest, it could be during exertion, and if you see a drop in 3%, you need to straight away rush to the hospital. And the second clinical parameter which I follow is a continuous or a steady gradual rise in your oral temperature. If your oral temperature continuously remains high, following fourth, fifth, or probably sixth day, means you're looking at viremia, means you're looking at the virus multiplying in your body, and soon it's going to hit your lungs or other defense mechanism of yours. So, these are the two clinical parameters which I follow very closely.
What is the right amount of oxygen level, Dr. Shah? Because there's a lot of debate on the oximeter readings, and I'll ask you first and then get Dr. Thakkar on this, because there's a lot of debate on this. What is the right amount of oxygen level that should give me a sense of security, and when should I start worrying?
See, you need to remember that when you get a rise in your temperature, when you get fever, that is definitely going to be a subtle decline in your oxygen saturation. But when you are afebrile and you start showing a drop in your oxygen saturation by 3%, suppose say your baseline is around 96, 97, and you drop down by 3%, you come at 91, 92, that's a matter of worry. That's a matter of concern. So that's when I take a call that, okay, patient needs hospitalization. Or it comes up with a complaint when patient comes up with a complaint of shortness of breath. The patient says that, okay, my shortness of breath is gradually going up from the 5th day to the 8th day. And doctor, now I'm breathless at rest also. So that's another symptom which I follow very closely.
But does a reading less than 94 need hospitalization, Dr. Shah? If I have a reading less than 94 on my oximeter, does that need hospitalization?
Not really. You can really do well around at 90, 91 also. But yes, it's an alarming signal. You need to get it to the notice of your doctor, whether you need to step up the approach, you need to get in steroid, or you need hospitalization, that your individual doctor will decide. But yes, 94 and below, it's a matter of concern then.
Okay. Dr. Thakkar, you want to weigh in on this oximeter question, because a lot of debate going on. What is the, should I be at home unless my oxygen level drops very sharply?
So, COVID cannot be treated by one pulse oximeter alone. I think all my colleagues have correctly echoed that you look at the patient as a whole. If by the 5th or 6th day, the fever is unrelenting. Unrelenting means more than 100.5 and above. If the patient's appetite is dropping, if the patient's oxygenation, which to begin with was 97, 98, is going down gradually, if the cough is absolutely chronic and not settling down, you treat the patient as a whole. This is an individual who has unrelenting fever, cough which is not subsiding, who has saturation going down. You don't wait for only one parameter. But having said that, if everything else is all right, and if the saturation suddenly drops under 92, 91, when the patient definitely has cleared his throat, taken deep breaths, and rechecked the saturation, yes, then you have to quickly think of going to the hospital. One warning here is a lot of people sleep in air-conditioned rooms. They leave their arms outside the blanket and the fingers get cold. They get up at night and put on the saturation meter and they see 88 or 86. Please don't panic. Rub your fingers properly, turn off the AC, see it in multiple fingers, make sure you're less than 92 before rushing to the hospital. So these are tips where you don't decide, but you call in your treating doctor. Your family doctor can decide for you. Your COVID doctor can decide for you. Don't panic unnecessarily. It's a conglomeration of symptoms that leads the patient to the hospital.
Because Dr. Thakkar, someone is asking, my oximeter reading is between 85 and 90. I am advised oxygen at home, but there is no oxygen in the market. What should I be doing? What is the treatment if my oxygen has now dropped between 85 and 90? Do I stay at home or do I panic and go to the hospital?
So this
And
is
if I'm
what
at
I was
home, how
saying.
do I get oxygen?
This is what I was saying. Even if you don't have any of the other symptoms, but your oxygen suddenly drops under 92, 91, and definitely under 90, we have a syndrome called happy hypoxia. The patient has no symptoms. He's happily sitting at home, but the oximeter gives the game away. This patient needs oxygen. If you can't give the oxygen at home, go to a jumbo center, go to a nursing home, go to a tent. And if you have no other choice, go to the hospital where they can provide you oxygen. So the oximeter plays the role only to lead and give a clue when the patient is otherwise normal, but he has a sudden drop in oximeter. Yes, this patient at 85 or 90 should not be watching our show, should be making his way to a hospital or to a nearby center for oxygen.
And is there an age factor, Dr. Thakkar? Do older peoples have to worry more if their reading is below 94?
Well, you know, older people with age have lost their respiratory compliance because their lungs have lived for 70 years versus a young man whose lungs have lived for 30 years. So if elderly people drop sharply under 91, or as my colleague said, 10% of the drop, then you need to quickly think of making arrangements. And hospitalization is not required. You can do home therapy. You can give oxygen supplementation at home. But elderly people, the red flag goes up faster than younger people. I agree.
But you know, Dr. Kantru, why don't you take this as a pulmonologist? Because what are these oxygen generators and concentrators? Because lots of people are saying, I want an oxygen concentrator at home. And if I can't get a hospital bed, will this help me at home? Do you recommend that people whose oxygen levels have fallen immediately look for an oxygen concentrator at home to self-medicate in a way?
Well, if the oxygen reading is showing something 85 or 90 consistently, it's not a one-off reading and the patient is visibly breathless and they're short of breath, not able to talk. Definitely, they might need oxygen inhalation if they don't have a condition called COPD, where the oxygen levels are chronically less than 90. Sometimes the body gets used to oxygen, which is between 88 to 92. Apart from this, the other strata, which is the normal strata, if they do drop their oxygen levels less than 90, then that is a worrying factor. And as we spoke, oxygen concentrators, these are the machines which use the atmospheric air, the nitrogen oxygen mixture, and extract the oxygen, and they work on electricity, right? So they have the capacity to suck in the atmospheric air.
And how many? And how often do I use it? I mean, how effective is it, and how often should I be using it if I'm a positive patient recovering at home?
Yes, definitely there is a role of weaning off patients. When we are weaning off the patients off oxygen, they have recuperated in the hospital, and we are sending certain patients to home with a prescription of low flow oxygen at home, which can be anywhere between 1 to 2 liters per minute. Then yes, this can be used at home, but one of the precautions is that you don't have to have a smoker nearby. There is a very good chance that if the flames, they catch fire, there can be hazards happening in the house. So you have to be very careful with these concentrators and not use any kind of inflammatory material around it, as well as these can be useful when you're looking for a hospital to get yourself into and treat there. So yes, concentrators might be helpful for certain people, but we should keep this in mind that those people who have a saturation which is above 92, it's not going to make them better. So this is not the treatment for COVID-19. It's just that somebody needs a drug when they are critically low in their oxygen levels.
Right. Okay, so you've got to use it wisely, sparingly, carefully. And it's not a magic bullet again. We keep reiterating this. To you, Dr. Sharma, do inhalers work? Is a question being asked. When my oxygen levels have fallen, do inhalers at all work, Dr. Sharma?
See, inhalers, there are two types of inhalers. One is which contains a bronchodilator, which actually makes the air sacs, they make them slightly bigger, and they start using the air sacs which are normally not used, which we call a dead space. The second type of inhaler contains a steroid. There have been studies, especially in UK and Europe, where steroid inhalers have actually worked very well for COVID patients. Of course, if oxygen level is down, then only steroid inhaler will not help. The person would require oxygen concentrator or oxygen in the hospital. But yes, if steroid inhalers and bronchodilators are used judiciously, then they definitely have a role. In fact, of all the medications that are being used, I think this is probably the only one where a proven role is there.
Let's come from the focus on oxygen, and remember, oxygen is a bigger crisis in hospitals as well. So use it sparingly, use it, don't panic is the message that the doctors are in a way sending out. Don't worry about immediate hospitalization unless there's a sharp drop in your oxygen levels. Let's turn to the other critical question, which is on vaccines. We're getting a number of questions on vaccines. Dr. Shah, I know you spoke to me a couple of days on this. Why don't you answer the question that I'm getting? Why are people getting infected even after 2 doses of vaccine? What does it mean, Dr. Shah?
See, one thing people need to remember is when the vaccines, when we read the literature of the vaccine and when we say that this particular vaccine is 60 to 80% efficacious, means that efficacy doesn't mean that you're not susceptible to COVID-19 infection. It means that it saves you from the severity of the COVID-19 infection. So that means that I'll be prevented from a critical or a severe stage or hospitalization because of COVID-19. But I'm still as susceptible to COVID-19 as a person who's not been vaccinated. And the second thing which ran through my mind is that normally when we go for vaccination, it's either a viral vector or an antigen which we introduce in our body to get a subtle immune response from our antibodies. Now, what if I'm an asymptomatic or a mild patient and I walk into the vaccination center and I go ahead and I take the vaccine? Most of our cases which we see early on in COVID-19 starts with a mild disease. So little runny nose, mild headache, little tweaky cough, we all consider this as normal staying in an urbanized society. We're just walking into the vaccination because it's the in thing right now that everyone wants to be vaccinated. You walk in, you take the jab, you're already harboring a virus where your immune system has been activated, alerted. And, on top of that, now you've introduced another antigen. Now, so your immune response kind of goes robust. I would say it's an observation or an anecdote, which I figured out that, post day 5 to day 16, I've come across at least 10 to 15% of patients who have been vaccinated coming up with complaints of shortness of breath and easy fatigability. And when you examine them, they have crackles all over. You send them for a CD chest. They have already progressed to probably 12 or 15 by 25 CD severity score. And then you are wondering that, with a very subtle low-grade fever, how did this happen? The only logical explanation which I could figure out is that probably your immune system had a robust response to the viral antigen, which was introduced in a form of a vaccine, and your active immunity or your innate immunity, which was alarmed by your mild to asymptomatic virus which you were harboring.
Dr. Thakkar, here is a viewer saying, I got infected after my first dose. When should I take the second dose, or is it not needed at all?
So there are multiple views on this. Initially, we felt that for anybody who has been infected, we only give one dose. Now, this gentleman has a virus infection after his first dose. So now we want to give another dose. I would wait for 8 weeks after he recovers from the viral infection before contemplating the next dose.
Okay, I took the first dose of Covishield. Can I take covaccine as a second dose, Dr. Thakkar?
So I think in last time's roundtable, we answered the same thing, that you can theoretically, and there are studies going on to cross one vaccine with the other as long as they are viral attenuated or vector-borne viral vaccines like covaccine, Sputnik, Covishield, etc. In fact, in Sputnik, both the doses are different doses. The first dose and the other second dose on the 21st are different vaccines. But as of now, none of the trial data is available for anybody to legitimately say that you should cross the doses. So I would still say, if you've taken covaccine, stay with it. If you've taken Covishield, stay with it. If you want to experiment, it's your body, but we still don't have any white paper on this. Definitely no crossing mRNA vaccines with viral vector vaccines. So that's important.
Okay. An interesting question, Dr. Thakkar, in the relation to vaccines again. My mother is 90 years old, got her first Covishield 7 weeks back, writes a viewer. Should we get her second jab done now when COVID is surging across the country, or do you believe that she should not take the risk of going to a clinic or a hospital for a vaccine in the current scenario? What do you recommend, Dr. Thakkar? Should she stay at home and wait a bit longer?
That's a very practical question. If they want to wait for another couple of weeks or 3 weeks before the surge settles, no problem. If they are feeling secure, they can even have it now. But God bless your mother at 90. She'll do well.
And linked to that, another practical question. Someone is saying, I've taken both my vaccinations. 5 days have elapsed. I have no symptoms. Can I leave my house and go for a walk in the park or not?
So as of now, we are in lockdown mode. You can walk in the building. There is no problem. If they allow you, you can go for a walk in the park, but you have not to forget your mask. You have to be fully masked. Even if 5 or 15 or 50 days get over, you have to wear your mask. If you have no symptoms and 5 days are over, you can go out.
How serious is the clotting issue in Covishield is being asked. Are women more vulnerable to clotting? What are the symptoms for blood clots I should look for, doctor? This whole issue, Dr. Thakkar, of clotting.
So the incidence of clotting is so minuscule and small. Not that it doesn't exist, but it's in such a small fraction that Astra, and Oxford have not withdrawn the vaccine, and we as doctors are still giving Covishield. Women in general in the reproductive era are more prone to clots, and the symptoms of clots are dependent on where you get the clotting. But I don't think you should worry about the clotting before thinking of going back to Covishield. Data has shown that it's such a small fraction that you should not worry about it. It's very rare.
Okay, let's come to Dr. Sharma on blood tests, because some of these issues, Dr. Sharma, I know you're dealing with. What is the CRP or C-reactive protein that doctors are looking for in my blood report? There's a lot of talk of CRP. What does it actually mean? What are they actually looking for, doctor? What should I be worried about, Dr. Sharma?
The CRP, basically C-reactive proteins, they are markers of any inflammatory process in the body. Whenever there is an inflammation, there is a cell breakdown and certain proteins are released. So routinely we say that CRP actually is a non-specific test. Any inflammation in the body, CRP would increase. Herein, in COVID patients, what we are worried about is once there is a condition called cytokine storm, where there is a sudden release of a lot of inflammatory markers. CRP rising titers again become very important over here because they help us understand how the inflammation is going on inside the body. That being said, one cannot base the management or the diagnosis on just one test. It is not only CRP, there are a number of other tests, but each one of them is specific for whatever complication we are looking for. Like there are lung complications.
Okay.
There at times are bleeding complications. There are other complications that can happen with COVID because ultimately it is going to spread to your lungs, and then rest of the things will start happening like poor oxygenation and everything. So CRP just tells us that there is an inflammatory process in the body.
It tells you about an inflammation that exists in the body. I just want to get Dr. Shah in because I know on vaccinations you have very strong views. Dr. Shah, anecdotally, many people are saying very few people once vaccinated get infected. But anecdotally, we are finding a number of people are. I mean, even though we were told that 0.03% of people vaccinated will be infected, anecdotally a number of people are, especially elderly. Do you fear that this is a problem? Is this because maybe possibly the vaccination is not being able to catch these new mutant strains? Is that possible, Dr. Shah?
So there are two possibilities which exist. You need to understand that this RNA viruses replicate very quickly. And when they are replicating, they get into a random genetic erroring in their program and they develop mutants. Now those mutants are very, very fast developed. The only RNA virus which we are aware of where we vaccinate all our patients is our seasonal influenza, where also we recommend to take vaccine once a year because every single year we find a new strain. So I wouldn't say the vaccines are not working. I would say we need to get a tweak in our vaccine or probably get a little upliftment in our vaccine if a variant develops, and probably give boosters if need be every 3 months, 6 months, or a yearly factor. And the second possibility, what I told you, was regarding the mild and the asymptomatic patients who are already harboring the virus and then they go ahead and take the vaccine, getting more susceptible.
Okay, let me come to this final segment, which is on general treatment and home remedies. Dr. Kantru, why don't you take this? Will the anti-COVID nasal spray perhaps become a game changer? Lots of WhatsApp messages going on around that this nasal spray should be brought to India. It's a game changer. Do you see it as more effective, possibly, Dr. Kantru, than the vaccine?
Well, I really wish it should be, because we do need a wonder drug which can take care of COVID patients at the moment. So the only drug which is decreasing mortality in COVID patients, as we know now, is the steroids, which are used in severe and moderate cases. So apart from these, if steroids and in certain strata of patients, if the Remdesivir doesn't work, we don't have any robust drug to offer to the patient. So we do need certain kind of wonder drugs, and I hope this nasal spray is going to deliver. But it's too early to predict that whether this is helping or not, because the studies are still on.
Let's talk about these drugs and settle this. People are hoarding at the moment Remdesivir, others are hoarding tocilizumab. What are these used for? Are people just wasting their money, Dr. Kantru, by hoarding these drugs? Are you recommending Remdesivir or tocilizumab?
Definitely, people are wasting their money, not only wasting their money by hoarding these drugs at home, they are depriving a person who might be the right candidate to administer these kind of drugs. And considering the rapid surge of cases, there is going to be deficiency of resources in the country, because the number is exceedingly large as compared to the resources and the infrastructure. So I would definitely urge people not to hoard things and use things judiciously. Remdesivir has a particular indication. It needs to be used in moderate to severe cases where the benefit has been seen with its use within 10 days of viral phase. So these are chosen by your doctor, and all the mild cases who are recuperating at home, those on home isolation, do not need these medications. And studies have clearly shown that we don't have any kind of benefit if we use steroids or remdesivir in mild kind of cases.
So, Dr. Thakkar, let's settle this Remdesivir argument today. We raised it briefly in our previous doctors roundtable. More and more doctors seem to recommend it. Prescriptions that I'm seeing have Remdesivir. When do I go in for Remdesivir or tocilizumab?
See, unfortunately, Remdesivir has become the go-to drug because there's really no treatment that we have prima facie for COVID. But like my colleague just told you, for mild cases or mildly moderate cases, we don't recommend Remdesivir. Remdesivir only shortens the stay in the hospital and produces good results in those patients who are moderately affected, seriously affected, and are given the drug under supervision along with a concomitant steroid for a period of 5 to 6 days. I must tell my viewers that when Remdesivir was introduced, it was a 12-day course, then shortened to 7 days, and now shortened to 5 to 6 days. So we are learning and thinking on our feet. Hoarding Remdesivir at home, besides wasting your money, is a crime. Please don't do that. There are people who might need it. But a lot of prescriptions are floating around is because patients are demanding Remdesivir. It has become like a go-to drug. Let your doctor decide whether you need it or you don't.
Okay, we have just about 5 minutes left. So these are now T20 style questions. Dr. Thakkar, you're well aware of how we do it. Quick answers. Dr. Thakkar, is pomegranate juice good for recovery? What are the superfoods to use for corona recovery? Do you recommend a diet, Dr. Thakkar?
Common sense, eat healthy, eat well. There is no specific anti-COVID diet.
Okay, does camphor help in improving oxygen levels, Dr. Thakkar?
Not that any study has been done, so I would not try and ignite camphor and produce any respiratory embarrassment.
Dr. Thakkar again, can one do jalal niti, a yogic form of nasal cleaning with betadine gargle too? Is it more effective?
Well, again, we don't have a study. You can do jal niti with jal, but jal with betadine, I'm not sure what it will do in the chemical form to your nasal passages.
Dr. Shah, should I fight fatigue and try and do things, or as a patient succumb to tiredness and sleep? Do you recommend a lot of sleep for your COVID-19 patients?
Yes, so, if your body demands rest and you are fatigued and tired, you need to address that, you need to respect that. Saying that, I also recommend, when we were talking about shortage of oxygen, I also recommend my COVID patients to follow something known as COVID awake repositioning or pruning. Means I recommend them to sleep on their stomach or on their face, which improves the oxygenation instantly. We are talking about magical wand. Probably this is one of the maneuvers which works instantly, and it can improve your oxygen immediately. So this is one of the things which I recommend when I tell my patient to sleep. I tell them that at least pruning for 8 to 10 hours.
Okay, so important to sleep well. It's an opportunity in a way for you to sort of get that fatigue out of your system. I want to ask all of you in a way, in conclusion here, what is it that you believe can be done to support the doctors and frontline workers at this point? Is there something as senior doctors that you would recommend? Dr. Kwantru, why don't you take that? What do you recommend the pressures which doctors have, frontline workers have? Is there a message as a senior doctor that you want to give today to the public at large?
Well, in the first place, I would ask and urge the country to be very empathic towards your doctor fraternity. I mean, there have been cases where we have seen everybody is, beating us left, right, and center. I would definitely urge people not to do that. And consider, the level of involvement all the people are putting on their part throughout the country, especially the doctors and the nurses. It's commendable. It's really commendable. So for the doctors, yes, they should take adequate sleep, which is very important for your mental health as well as for your physical health. Because I work in the ICU, once I go to the ICU early morning after a fresh sleep, I am able to make decisions in a better manner. So it's really important we take care of our mental health and physical health. Though it is becoming a challenge in these days when the surge of cases is so much and everybody wants to have your advice, everybody is calling you. But yes, listen to music, have good sleep, go back to your hobbies, even if it is for 5 to 10 minutes, switch off your mobile phones at least for 10 minutes a day. That will do the trick.
Dr. Sharma, a viewer is saying that he is rushing around Gurgaon hospitals and his father desperately needs Remdesivir. Nothing is available in the market. There's of course already the shortage of oxygen. How do people cope with panic? When people are panicking, what do you tell them? What do I tell this viewer who's saying, look, I'm running around Gurugram hospitals, I'm not getting Remdesivir anywhere as the doctors have recommended, and there is a shortage of oxygen. What do you tell someone like this if I can't find a bed today in Delhi or Gurugram?
See, Remdesivir, it has been proven, and I think we have discussed it again and again, that there is no proven role.
Yes.
And buying Remdesivir in black market, you're not even sure what you're getting. So one should stop running after it, running from one place to other. If there is no bed available in Gurugram, there have been a lot of informations where, hospitals which are available, which do have beds or which do have oxygen, some amount is still there. One can try that hospital.
I just want to say that, patients have had a very, very difficult time. They are panicking at the moment. I want a final word from you, Dr. Thakkar. What do you tell family members who are panicking?
So before we have the next round table, I want you to sit on a black three-legged table with a black cat and do some voodoo for two reasons. One, to take the virus away, and two, to instill a sense of responsibility amongst citizens. Panic makes wrong decisions. WhatsApp gives you wrong information. Follow the discipline, be logical, do not treat the report, treat the patient. Don't think that you are in the worst wagon. There are people more ill than you. Be patient, listen to your doctor, don't create artificial shortages, and even this will pass away as history has shown. Be firm, be responsible, and follow the rules of the game.
Follow the rules of the game. Thank you all very much, though, for joining us on this extremely enlightening Doctors Roundtable, taking all the questions that our viewers have sent in. As always, all I can say is thank you very much to our doctors, but more importantly to each and every one of you at home. Stay well, stay safe. This too shall pass.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.